Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Friday, April 3rd, and this is my daily briefing. Today in Missoula, we are up to 21 cases. That's up 4 from yesterday's briefing. There are 243 cases in the state, and so far there have been 5 deaths in Montana and other counties. Today's briefing is going to kind of touch on some of the buzz that you've been hearing about asymptomatic spread and the re-evaluation of wearing masks. Hopefully we can help dispel some myths and talk a little bit more about the known and the unknowns and how you've been protecting yourself from this risk the whole time. First, we need to talk about the difference between true asymptomatic spread and pre-symptomatic spread. So true asymptomatic spread is when someone gets the virus and can spread it, but they never show any symptoms. Pre-symptomatic spread is slightly different. So pre-symptomatic spread means that the people get the virus, they spread the virus before symptoms show, but they still develop symptoms. Both of these methods can be called asymptomatic transmission. And as you can see, this terminology can be misleading because it suggests that people never show symptoms when that's not true with the pre-symptomatic group of people. Now, I know that you've heard some pretty startling statistics in the news, like 1 in 4 cases are spreading disease without showing symptoms. But the CDC's director's statement was taken to the extreme and likely taken out of context. He said that it could be as high as 25%, which suggests that the real number is likely lower than that. The World Health Organization has found few, very few, truly asymptomatic positive cases where people never developed any symptoms. Other studies have gone back and reevaluated whether asymptomatic positive cases in Asia and let me try that over again. Other studies have gone back and reevaluated the asymptomatic positive cases in Asia. And what they found is that most of them actually did have symptoms, but they were very mild and they were dismissed as something other than COVID-19. So let's talk about the numbers. The CDC's Morbidity and Mortality Weekly Report published a study that found that only 6.4% of transmission by pre-symptomatic spread. Another journal found around 12.6% of pre-symptomatic transmission in an area outside of the Hubei province in China. So what do all of these numbers mean? The CDC and Dr. Fauci from the National Institute of Allergy and Infectious Disease acknowledges that the study suggests some type of asymptomatic transmission, most likely pre-symptomatic transmission, and can be spread from individuals with mild cases that don't realize that their mild fever or body aches are actually COVID-19. However, much of the transmission that is happening and how that affects our response is still under evaluation. They're still trying to figure a lot of this stuff out. So the percentage of pre-symptomatic spread in these studies has a really large range, and the sample sizes in the studies are relatively small, so it's not actually very representative of larger populations. That doesn't mean that the data isn't showing us something. It just means that we can't really say 1 in 4 are unknowingly spreading the illness as a fact. The number is actually probably much lower than that. It also doesn't mean that pre-symptomatic spread is the main driver of the infection for COVID-19 like it is with flu. So the CDC still says that the main driver for COVID-19 human-to-human transmission is with symptomatic individuals, but they're continuing to evaluate the evidence, and they will change the guidance if the evidence does indicate that we need to change that guidance. When they change their guidance, we will change our guidance here at the health department as well. So that being said, as I discussed yesterday, the CDC has already changed some of their recommendations in light of this information, which we have already adopted here at the Missoula City County Health Department. For example, our contact tracing procedures have now changed to include close contacts during possible asymptomatic period. So as I also discussed yesterday, people who are following all of those quarantine procedures when we ask you to quarantine yourself is a very important tool to prevent that asymptomatic transmission during the pre-symptomatic period. What this doesn't change is the limitations that we still have with testing. We still have the same number of tests. The CDC guidance on testing is still the same, and it's still not clear how reliable the test is. at detecting illness before you're actually developing symptoms, which is why we cannot use it to reliably test asymptomatic people to determine if they're going to get sick and spread the illness. However, and I hope that this is a comfort to all of you out there who are listening to me, this does not change how you protect yourself. What we've been telling you this whole time about staying 6 feet away from people who are outside of your immediate household, with social distancing, staying home as much as possible, and washing your hands is still how you will protect yourself from getting asymptomatic spread or otherwise. If you practice the proper social distancing practices that we've been talking about, you're still not going to get exposed. So now we want to talk about masks. In light of the potential for asymptomatic transmission, the CDC is currently reviewing their recommendations when it comes to masks for the use of general public. But despite what some are saying, this is not an actual U-turn in their policy. So here's the thing. From the very beginning of this pandemic, health officials have asked healthy people not to wear surgical masks because they are in short supply, and we really need them for people like healthcare workers and first responders who cannot actually practice safe social distancing because they are caring for sick patients who need them to be healthy. So the general person in the population does not follow these procedures. We are all trying to practice social distancing, staying as far away from other people as we can. So in that respect, we're still protecting ourselves, where a healthcare worker or a first responder can't stay 6 feet away from their patient. The CDC is not thinking about asking healthy people to wear surgical masks to protect themselves from getting sick. They are considering asking people to wear cloth masks in case they are sick and they just don't know it yet, to prevent that pre-symptomatic spread. This is not any different from asking a sick person to wear a mask. It's just taking it one step further in the case of pre-symptomatic spread. So the other thing that that needs to be recognized is that wearing a mask doesn't do you any good if you keep fiddling with it and touching your face and adjusting it and pulling it down and back up and not following proper hand washing procedures. You're actually increasing your risk of exposure and providing a false sense of security. I know that a lot of people say I can put a mask on and not touch it and not fiddle with it, and that's great, but a lot of people, having a mask on is really annoying, and you constantly want to be messing with it to try and make it more comfortable if you have to wear them a lot. So I've covered a lot, so I just want to kind of summarize everything that I've talked about today. Yes, pre-symptomatic spread could be happening. How much, we don't actually know at this point. Completely asymptomatic people spreading the illness seems pretty unlikely based on current data. That could change as we're learning more about the COVID-19 disease, but right now they do not believe that asymptomatic people are spreading the illness. The CDC is reviewing the data that's available to see what solid recommendations they can provide based on the limitations of the studies that they have. When the CDC changes their recommendations, we here at the health department are going to change ours because we base all of our recommendations on the recommendations from the CDC. The preventative measures that we've been telling you about this whole time, like social distancing, staying home as much as possible, hand washing to prevent exposure regardless, it's going to help prevent exposure regardless of pre-symptomatic spread. So we just want to remember that this is not airborne. We're still talking about droplets, and droplet precautions still remain the same. So even if you see an article that says that you can spread it by breathing, what they are meaning are respiratory droplets that you exhale and not just breathing the air itself. Our tools like contact tracing, isolation, and quarantine also take pre-symptomatic spread into account. And the fact that the CDC is reviewing mask guidance is not a flip-flop. People wearing masks won't protect themselves from getting COVID-19. Preventing exposure by social distancing can. So we still want to keep the surgical masks for our healthcare providers and first responders who really need them. And the recommendation is under review as whether people should wear cloth masks to see if that might prevent a seemingly healthy person who hasn't yet developed symptoms from spreading COVID-19 during the pre-symptomatic period. So I hope this helps people understand some of the information that we're really hearing a lot about in the media, and provide some reassurance that even if we do have pre-symptomatic spread, that you're still using, if you keep using the same tools, you are going to be able to protect yourself from that. So that's all I have for my daily briefing today. I just want to remind people that you can tune in and subscribe to my YouTube channel. It's under my name, Cindy Farr. That's CINDYFARR. Click the little bell so that you can get that notification when a new video comes out. Follow us on Facebook at the Missoula City County Health Department. You can check out our website at missoula.co/cvirus. And if you have questions, you can certainly call 406-258-INFO, and that information line is manned by actual people, mostly nurses, that are available to answer your questions from 8 to 5 Monday through Friday. And if we start seeing that we have a need for it, we can certainly be expanding those hours. So that's it for today. I will talk with y'all again on Monday, unless we have something really big happen over the weekend, and then I will certainly be putting out another video over the weekend. Until then, stay healthy, and thanks for everything that you're doing to help keep everyone in our community healthy as well.